Prostate cancer. Prostate cancer is a type of cancer that develops in the prostate gland, a gland in the male reproductive system that produces seminal fluid. It is one of the most common types of cancer in men, especially in older men. Prostate cancer screening. Prostate cancer screening involves testing for prostate cancer in men who have no symptoms. The two most common screening tests for prostate cancer are the prostate-specific antigen (PSA) blood test and the digital rectal exam (DRE). Prostate-specific antigen (PSA) screening. The PSA test measures the level of PSA in the blood. PSA is a protein produced by the prostate gland. Elevated levels of PSA may indicate the presence of prostate cancer, but they can also be caused by other conditions such as prostatitis or benign prostatic hyperplasia (BPH). Therefore, a high PSA level does not necessarily mean a man has prostate cancer, and further testing may be needed to determine the cause of the elevated PSA level. Digital rectal exam (DRE) screening. The DRE involves a healthcare provider inserting a gloved, lubricated finger into the rectum to feel the prostate gland for any abnormalities. The DRE can detect lumps or other abnormalities that may be a sign of prostate cancer. The American Cancer Society recommends that men discuss the prostate cancer screening with their healthcare provider, starting at age 50 for men who are at average risk of prostate cancer. Men at higher risk of prostate cancer, such as those with a family history of the disease, may need to start screening earlier. It is important to note that prostate cancer screening is not perfect and can lead to false positives or false negatives. A false positive result can lead to unnecessary further testing, while a false negative result can delay diagnosis and treatment of prostate cancer. Therefore, it is important to discuss the benefits and risks of prostate cancer screening with a healthcare provider to determine if screening is appropriate for an individual. Prostate cancer symptoms. Prostate cancer in its early stages may not cause any symptoms. However, as the cancer grows, it can cause a variety of signs and symptoms, including urinary problems, difficulty urinating, weak or interrupted urine flow, frequent urination, especially at night, and the need to strain and empty the bladder. Blood in urine or semen. Blood in the urine or semen can be a sign of prostate cancer, but it can also be caused by other conditions. Pain or discomfort. Pain or discomfort in the prostate area, lower back, hips, or upper thighs. Erectile dysfunction. Difficulty achieving or maintaining an erection. It is important to note that these symptoms can also be caused by other conditions, such as benign prostatic hyperplasia (BPH) or an infection, and may not necessarily be a sign of prostate cancer. However, if you are experiencing any of these symptoms, it is important to see your healthcare provider for an evaluation. Early detection and treatment of prostate cancer can improve the chances of successful treatment. Prostate cancer risk factors. The exact cause of prostate cancer is unknown, but several risk factors have been identified. Age. Prostate cancer is rare in men under the age of 50, but the risk increases significantly after age 50. Family history. Men with a first-degree relative, father, brother, or son, who has had prostate cancer have a higher risk of developing the disease. Race/ethnicity. Prostate cancer is more common in African American men and less common in Asian and Hispanic/Latino men. Obesity. Men who are obese have a higher risk of developing prostate cancer, particularly aggressive forms of the disease. Exposure to certain chemicals. Exposure to certain chemicals, such as cadmium, may increase the risk of developing prostate cancer. Hormone levels. Prostate cancer is fueled by male hormones called androgens, such as testosterone. Men with high levels of these hormones or who are treated with testosterone may have a higher risk of developing prostate cancer. Regular screenings and early detection can help identify prostate cancer in its early stages when it is most treatable. Thank you for watching. Subscribe for more videos.